going to do now is we're going to observe your mouth and your nose. We're just going to make sure there's no irregularities, no obstructions, no type of ulcers or any type of bleeding or scabbing. So first I'm going to just observe. So right now I'm going to be looking at the nose. I'm looking at the alignment, make sure the nose does not have a deviated septum. From our viewing, it looks fine. Making sure there's no mucus discharge or coloration coming out of the nose or any crusting around the nose. Also right now I'll be inspecting the lips, looking at the lips, making sure there's no cracking or any type of scabbing or maybe any type of ulcers on the lips, which look good. So now I'm going to inspect your nose. So this will just be looking at the redness, looking at the color, seeing if maybe it's red or a mulberry color, or if there's mucus in there, or if the turbinates are swollen. It's good? Good. Everything looks normal there. Okay. So next what we're going to have you do here is I'm going to look and inspect your mouth. I'm just going to have you open up real quick. Good. Everything looks good there on quick inspection. Okay. Next what we're going to do here is I'm going to take the tongue depressor. I'm just going to lift up your upper and lower lip. I'm going to be looking at your teeth coloration, making sure there's no discoloration or any issues going on with your teeth. Also, I'm going to be looking at your gums, making sure that they're not swollen and they're looking like the right color. Okay? Good. Good. Okay, next what I'm going to have you do here is I'm going to have you just stick out your tongue for me. Good, I want you to say ah.
Ah.
Good. I'm just looking at the top of your tongue, making sure, looking for like leukoplakia, candida, any issues that might be present on the top of your tongue. I'm also assessing for halitosis, which there is none right now. Next, what I'm going to have you do is I'm going to have you lift up the top of your tongue. Good. And I'm going to look at the bottom, the roof of your mouth. I'm also going to look at the sides of your mouth. Good. From there, all we're assessing is I'm assessing if there's any outcroppings on the bottom of your mouth or the top of your mouth. I'm looking at the frenulum of your tongue. And I'm also looking at the bottom of your mouth to see the collection of saliva at the bottom of your mouth and the color of the saliva at the bottom of your mouth and the mucus. We're also looking at the Wharton's ducts on the bottom of your mouth and the sides. We're looking at your parotid and your Stenson ducts. And we're checking for petechia or any like Koplik spots. Next, I'm going to have you again just say ah, and I'm going to check the back of your mouth again. Good. There, we're just looking at your tonsils to see if they're swollen, and we're also looking at the pillars. Next, what we're going to do is I'm going to check your gag reflex. So I'm just going to have you say ah, and we're just going to lightly. Good. Good response. Very good. Next, what we're going to do here is I'm going to take a cotton swab. We're going to wrap this around your tongue, and I'm going to be looking at the sides of your tongue. So again, assessing for any candida, leukoplakia, any issues that might be on the side. I'm also going to look at the top of the tongue and the bottom of the tongue again, just to make sure I get a good assessment here. I'm going to have you stick your tongue out. Good. Good. Everything looks good there. Nothing to be concerned of. Again, I would typically have gloves on. Since I know you, we're okay. All right. And then I'm going to check your parotid, your glands, your sinuses. Okay. Checking your frontal sinus and your maxillary sinus. I'm just going to press on them. Is anything painful on either side?
No.
Anything painful here on either side?
No.
Next, I'm going to tap. Anything painful?
No.
Anything painful?
No.
How about here?
No.
And here?
No.
Good. Next, we're going to check for obstruction. I want you to put your finger on one side of your nostril, and I want you to breathe in. Good, through your nose. Now, there's no obstruction. I want to assess the other nose. Good. A little bit of obstruction, but could be due to a little bit of cold. No big deal. Okay, so we checked the cranial nerve for your gag reflex. Now we're going to check the next cranial nerve. I want you to stick out your tongue. Good. That works perfect. And that is it. We have done everything. Everything is normal and looks good.